Good afternoon, and welcome to the Johns Hopkins 30-minute COVID-19 briefing, where we provide live insights from the experts who lead our work at the Johns Hopkins Coronavirus Resource Center. For the next half hour, we'll focus on what you need to know right now about the COVID-19 pandemic and public health responses. As part of this briefing, we'll have an opportunity for live Q&A with our experts, and we'll be offering these 30-minute briefings regularly on Fridays at 12 p.m. I'm Dr. Lainie Rutkow, a professor in the Johns Hopkins Bloomberg School of Public Health, and I'm part of the leadership team for the Johns Hopkins Coronavirus Resource Center. We'll be providing answers in real time today, so please submit your questions in the box at the bottom of your screen. Before I turn to our experts, I wanted to remind you that the Coronavirus Resource Center recently launched a newsletter called The Week in COVID-19. This is a wonderful way to get the latest analysis from our experts about vaccines, variants, and other vital COVID-19 trends. It will be delivered to your inbox every Monday. And throughout this briefing, you'll see a banner on your screen where you can click to sign up for the newsletter. I'm now going to introduce our three guests. First, Beth Blauer is Associate Vice Provost for Public Sector Innovation at Johns Hopkins University. She'll be speaking with us today about COVID-19 data. Then Dr. Jennifer Nuzzo is a senior scholar at the Johns Hopkins Center for Health Security and an associate professor at the Johns Hopkins Bloomberg School of Public Health. Jennifer will give us an update about the trends that we're seeing in the pandemic and the path forward. Finally, Dr. Bill Moss is Executive Director of the Johns Hopkins International Vaccine Access Center and a professor at the Johns Hopkins Bloomberg School of Public Health. Bill will give an update about COVID-19 vaccines. I'm now going to turn to each of our experts for a quick overview. Beth, I know that you're only with us briefly this afternoon, so I'll ask you one question with a few parts. Over the last 16 months, we've seen stakeholders in the US and throughout the world develop a new appreciation for data. I was hoping that you could give us a sense of the role that you've seen data playing in the COVID pandemic, both the highs and the lows, and then tell us a bit about the Pandemic Data Initiative, our new effort at the Coronavirus Resource Center.
Yeah, thank you, Lainie. It's so great to be back on the Friday briefing, and thanks everyone for joining us today. Data and public data have taken on an entirely new role in public discourse, and that is deeply related to the experience that we've all collectively globally felt in the last 16 plus months related to COVID. I look fondly in some way back at the early days where we started to create a new common language that we all shared together, whether it was our students who were learning about what flattening a curve meant, or whether it was really thinking about some of the basic data that was really being collected early on. But what we saw over the last 16 months was a transformation of public data around public health. And it revealed a lot of opportunities to strengthen the public health infrastructure that has really been built up around the ability for local governments, state governments, federal governments, international governments to share in an agile way data with each other to really develop a very tangible public health response. We know that up until the proliferation of vaccination, that public policy was really our only opportunity to contain the disease and to really think about how to intervene. And what ended up happening was data was at the core of all of that decision making. So over the course of the last 16 months, we've seen very big highs where state governments, international governments were very quickly able to produce and build data infrastructure that allowed us to get data out to the public. It was guiding our personal decisions about whether we would go out and to the public and engage in public life. And it was also guiding our decisions around whether our economies were open, whether our schools were in session, and whether we were engaging collectively in public life. And so we launched this week the Pandemic Data Initiative, which is going to be not only a retrospective on all of the opportunity that data has provided for us as public health professionals, as public sector professionals, but also the real challenges of not having that common language, not having standardization around that data, and what it will mean and how we can inform the future of public health data collection. And so I encourage everyone to log on to the site and to take a look at the Pandemic Data Initiative as we start to take apart what we've all collectively experienced, but from the perspective of data and how data has aligned and changed in the role that we all have played throughout the pandemic. Thanks again.
Thanks so much, Beth. I know you have to jump, but really great to have you back today. And for those of you that click on the banner and subscribe to our newsletter, that will include a weekly update from the Pandemic Data Initiative. I'm now going to turn to Jennifer. So Jennifer, over the last week, businesses in the US have started working on their own responses in light of CDC's recent guidance about masking and distancing, especially for those who are fully vaccinated. What do you see as a sound response at this point, and what should be the role of testing?
Sure, Lainie. Thanks so much. Just to emphasize where we are, to maybe put it into some context. So nationally, we're looking quite great, actually. It's really encouraging to see nearly every state saw decreases this week. For the first time this week, every single day, we saw fewer than 30,000 cases. So our current running day 7-day average is about 29,000 cases per day. We haven't seen numbers this low since early September before the winter surge. So I really like the trajectory that we're on, and I hope that trajectory continues. I have every reason, to think that it should and it can. In terms of deaths too, we also have to, I think, focus on what we know has been one of the biggest concerns about this virus is its potential to cause severe illness and cause deaths. Deaths are also similarly down. Last week, we saw a bit of a plateau, but I'm happy to say that this week there was a 10% decrease in the number of deaths being reported. Testing is also showing decreases in national test positivity. For the first time, we are under 3%. We haven't been that low since much earlier in the pandemic. So again, very, very encouraging signs. I think going forward, we have to consider a few things. First of all, the continued rollout of vaccines will remain incredibly important. And truthfully, this is a lot of why I think we're seeing these very encouraging changes in our cases, deaths, and testing metrics. Of course, as our case counts continue to fall and the probability of infections continue to drop, that does potentially change somewhat the role of testing. We know that when we test people without symptoms, we always have to interpret if we had a positive test, whether that test is likely, that test result is correct. And that becomes a little bit trickier to do as the probability of infection decreases. So I do expect that there'll be a continued emphasis on symptomatic testing, and that remains essential. Everybody who has symptoms should get tested, including people who are vaccinated. That remains unchanged, that need. But perhaps we may think about how and if we test people without symptoms. The CDC recommends not testing people who have been vaccinated who don't have symptoms. We have seen some people test positive, but the question is, what does that positive test mean? And so it becomes a bit of a trickier consideration where, in my view, the routine testing of vaccinated people who don't have symptoms I don't recommend that. Of course, there's also been some other changes that I think put into context how businesses and others are going to navigate the next few months. And the biggest one, I think, is what we're seeing happen following the issuance of CDC's new masking guidelines for vaccinated individuals. What the CDC said is that if you're fully vaccinated, you don't need to mask in an effort to protect yourself or others, because the probability of becoming infected and the probability of transmitting to others, if you are fully vaccinated, is quite low. Unfortunately, many states we're seeing have, in my view, misinterpreted this guidance, which is really just laying out the science for what level of protection vaccines offer. They've interpreted that guidance as masks are no longer required for anyone in indoor spaces. We've seen a number of states, including here in Maryland, basically lift the indoor mask requirement. This, of course, has caused a lot of worry, whether we will see an increase in transmission among the unvaccinated. I have to stress that it's among the unvaccinated, because I think everybody is potentially interpreting these policy changes as meaning that they are now at increased risk. But if you want to not be at risk from these policy changes, the way you do that is to get vaccinated. But if you are unvaccinated, the risk remains. Now, where I think there is a lot of anxiety right now is among parents who have kids who are too young to be vaccinated. So we don't have yet vaccines available for children under 12. And I hear from a lot of parents who are wondering, how they navigate the summer, how they navigate the next school year. And I understand the worries that they have. It feels like everything is changing around them, and that's putting their children at increased risk, and they didn't ask for that. So I very much feel that. I will just say, as a mom to two young kids who are too young to be vaccinated, the way we're navigating it as a family is that, one, I don't view my children as being unprotected from COVID-19. The fact that my husband and I are both fully vaccinated is a very important move to protect my children. So if you are in similar circumstances, one thing you can very much do is encourage the adults in your children's lives to get vaccinated. We know from Israel that adult vaccinations drive down infections in all age groups. In fact, Israel has seen, since the rollout of its vaccination campaign, a 98% drop in infections in kids, despite the fact that they're only vaccinating people over the age of 16. So let's keep on going with the vaccination efforts. That will be really important to protect children. Also, all the other measures that we've been using the last year are still ways that we can protect people. And so my children will continue to wear masks in crowded indoor spaces and in places where I don't feel like they can adequately maintain distance. I don't worry as much about outdoor spaces, though if they were in a very sustained exposure to somebody in very close circumstances, I might feel differently. So that's, I think, how we can continue to protect children. I just want to offer a little bit of reassurance to parents who have had so much worries on their plates for the last year. But what happens over the next few months is determined by how many people we get vaccinated. So I feel very strongly that we should all work to get the adults in our lives vaccinated and continue to have conversations to encourage that to happen. One more thing I just wanted to mention on the school front, because it has come up now in multiple circumstances. There's actually a new study out today from the CDC in their MMWR publication, looking at COVID incidents in K through fifth grade schools in Georgia. And in particular, they tried to look at different mitigation techniques employed by these schools and tried to see which ones had the most effect in terms of reducing the amount of COVID cases that were reported in schools. And I think these data that are out today are quite encouraging. What they found is that they looked at 169 K-5 schools from a period of November to December. They tried to adjust the amount of COVID they found for the level of community incidence. And what they found was that there was a noticeable 37% reduction in COVID incidence in schools that required teachers and staff members to use masks, and a 39% reduction in schools that use ventilation. They looked both at ventilation that comes in the form of dilution, where you open the windows or turn on some fans just to move the air around and to reduce the number of viral particles in a space. And they also looked at it in terms of more high-tech things like filtration approaches, where you try to remove the viral particles from the air. And they found that dilution actually does a pretty good job. There's a little bit more of an effect when filtration was used, but I think it's quite encouraging that just opening a window can have a fairly important effect on reducing the risk of transmission in school classrooms. They also looked at mask use in kids. They actually didn't find a significant difference in schools that made kids wear masks or not, but it's not clear that was because there was no difference. It just may have been that, we don't know if it's just that the kids weren't wearing the masks properly in the places where they were supposed to be wearing them. But I think the takeaway here is that, again, adult protection and opening windows and improving ventilation. In a windowless classroom, you can use these filtration devices. Those will be helpful. And so in thinking about returning young children who are too young to be vaccinated to schools in the fall, I think we have a lot of promising data at this point that it is possible to do safely and without that much change. There was no difference between 6 foot distance and not. So I think I am hopeful that we can see kids back in schools in the fall in semi-normal circumstances.
Thanks so much, Jennifer. I'm now going to turn to Bill, but first I want to remind our audience to please submit questions for our experts, and right after Bill's remarks, we'll move into Q&A. Bill, as the vaccine supply increases in the US, we're hearing more and more about the role that the US could be playing in the global vaccination effort. Can you give us a sense of how the US can help to ensure that the pandemic is ultimately controlled throughout the world?
Yes, I think we're at, thank you, Lainie. I think we're at a critical juncture here in the United States with the progress that we've made. And the United States really needs to pivot and be a global leader in addressing the global vaccine inequities. As Jennifer outlined, the progress that we've made here in the United States are really driving down cases, hospitalizations, and deaths. And as she pointed out, really driving down transmission so that as in Israel, children who are ineligible to be vaccinated are protected because of the vaccination of older adolescents and adults. So that is a very important milestone and progress that we've made. We've administered close to 280 million doses here in the United States. We're creeping up on the milestone of having half of the US adult population over 18 years of age fully vaccinated. We're about 48%. Again, getting up to a critical milestone of 3/4 of adults older than 65 years of age fully vaccinated. Now we're at about 61% of adults have received one dose. The Biden administration has set a goal of 70% by July 4th, so we still have a ways to go. We're still at reasonably high levels of daily vaccination. Our 7-day average is about 1.6 million, but this has come down. The pace of vaccination here in the United States has decreased from a peak of over 3 million doses being administered per day. And the Biden administration and the US government are doing a number of things to try to improve access to vaccines and to increase the demand. Those are the two kind of big buckets that we need to address to more fully vaccinate the US population. There are also a lot of innovative incentives being instigated by states and local jurisdictions. And Lainie, here in Maryland, Governor Hogan announced a program that if you get your shot, you can you have a shot to win. I'm sorry, get your shot for a shot to win. And so beginning May 25th, the Maryland Lottery will randomly select and award $40,000 to vaccinated Marylander every day through July 4th. And then there's a final drawing for a grand prize of $400,000. And so any person, any Maryland resident who is vaccinated in this state is automatically enrolled in this lottery. And so, I think it's a good sign that we're seeing creative responses to try to get the remaining people in the United States vaccinated. But I must say, Lainie, I think from a global perspective, people must look at this with astonishment in many countries where the demand for vaccine is so great. And just to talk about that, just to do a rough back of the envelope calculation about what is the global need for COVID-19 vaccines. And if you just take, a global population of about 8 billion, 2 doses per person, and let's say we wanted to vaccinate 70% of the global population, we're talking about over 11 billion doses would be the global need. Thus far, only about 1.7 billion doses have been produced, 1.2 billion administered. So we have a long way to go to reach 70% vaccination of the U.S. Of the global population. Now, the U.S. has done some things. They've committed $4 billion to COVAX, which is the global mechanism to get vaccines to low and middle income countries. Obviously, we as a country have re-engaged with the World Health Organization. Very important activities. The Biden administration will be donating 60 million doses of the AstraZeneca vaccine after FDA clearance of those vaccines. We obviously those vaccines aren't authorized for use in the United States. And then recently the Biden administration announced 20 million additional doses will be donated by the end of June. That'll be comprised of Pfizer, Moderna, and Johnson & Johnson vaccines. And there are other efforts, smaller efforts to increase vaccine manufacturing and releasing restrictions on the export of critical materials and discussions around intellectual property rights. But I want to say, just to put this in context, what the U.S. government is doing, just today, the European Union pledged to supply 1.3 billion doses of vaccines to low and middle income countries. Now, this followed on the heels of an announcement by Albert Bourla, the CEO of Pfizer, that they were going to allocate 2 billion doses of their messenger RNA vaccine to low and middle income countries. 1 billion of that European Union commitment will come out of that. And then there'll be 200 million doses of Johnson & Johnson and 100 million doses of Moderna. The European Union has also announced an initiative to boost vaccine manufacturing capacities in Africa, which is another really important initiative. And so I just want to put, I think in some ways this actually shames the U.S. response and shows them really what kind of magnitude of response we need globally. We need to be talking about billions of doses that we need to get to the global population. 20 million doses is really just a drop in the bucket there.
Thanks so much, Bill. I'm now going to turn to questions that have been submitted by our audience members for you and Jennifer. Jennifer, first to you. Can you pick up on where you left off, thinking about kids in school and the fall? Based on the latest report, what do you think the fall might look like for kids in school? Is hybrid learning going to continue to be a part of our lives?
I hope not. I mean, I think we have seen that it's possible to return children to schools. Hybrid learning was really pursued because of a concern that we needed to space children at least 6 feet. And we've now had a number of studies that have suggested that that probably doesn't make a difference. Opening the windows does. The study that I talked about looked at masking teachers. Of course, now we know that teachers are eligible to be vaccinated, so that changes it a little bit. But small changes and cheap changes can actually do a lot to increase safety in classrooms, even among children who are too young to be vaccinated, which is what this study looked at, the K to fifth grade. We now know that children over the age of 12 are able to be vaccinated, so I think that makes that prospect safer. So it's my hope that children will return to school full time in person. Certainly something that the Biden administration has stressed is the goal and should be the goal. I know as a parent and with kids in school, I think the lingering worry has been on, well, what about our unvaccinated children? And I think that there are other ways that we can protect our children. I also expect our case numbers to be much lower by the fall, which should help as well.
Thanks, Jennifer. And one more for you. So since CDC's guidance came out about masking and distancing relative to those who are fully vaccinated, we've heard increasing concern from individuals who are going back or contemplating going back to the office for the first time in close to a year and a half. What's your best advice to help folks feel safe as they move into that return to the office process?
Sure. Well, in many ways, it's a parallel of the school issue, though we have the benefit of having vaccines available for children. So if you're a vaccinated person, that you're not really the ones that we worry about. We worry about the people who are unvaccinated in those circumstances. And so that's really why it's so important in these months ahead. I mean, we have shifted into this phase, like it or not, where we are navigating COVID risks as individuals. And the way to lower your risk is to get vaccinated at this point if you are old enough to be able to do so. So I think it's really important to talk to your healthcare providers, talk to everybody about the benefits that vaccines will offer you to eliminate those worries about being back in office spaces and other places.
Thanks, Jennifer. Bill, I'm going to turn to you and pick up on something that you mentioned in your remarks. So, where you talked about the Maryland lottery and the role that it's going to play in providing an incentive to get vaccinated. What do we know, or what are your thoughts about incentives to encourage vaccination? This is something that we're hearing about not just in Maryland, but throughout the United States now.
Yes, I haven't seen any data yet that supports that these incentives work. I imagine that there is a small proportion of the US population that who might be influenced by these incentives. But I think the important thing for people who've been reluctant to be vaccinated is to really understand what their concerns are. And they vary, but a number of concerns are around the potential safety of these vaccines. Some of that is driven by a feeling that these vaccines were rushed. Part of that is driven by the experience we had, for example, with the Johnson & Johnson vaccine. So safety is one concern. Some people kind of in their mind have downplayed the importance of the pandemic, and so just don't see the threat. So as I kind of often think in a simplistic way, what underlines a lot of vaccine reluctance is overestimating the risk of the vaccine and underestimating the risk of the disease. It's not clear to me that these kinds of incentives will address those concerns. That's my main point. And if someone is concerned about the safety of the vaccine, will a lottery push them over, push them over that tipping point and such that they would get the vaccine? So I think we'll need to see. My guess right now is that the impact's going to be marginal of these kinds of incentives, just understanding, given our understanding of what the reasons underlying the reluctance.
Thanks, Bill. One more for you. What do we know about the window to get the second dose of the mRNA vaccine, so Pfizer or Moderna, and what happens to folks who find themselves getting their second dose outside, in some cases, well outside of that window?
Yeah, so that window was designed for for the phase 3 trials, and it actually was deliberately selected to be a relatively short window, 3 weeks for Pfizer, 4 weeks for Moderna. And the fact is, that from the phase 3 clinical trials, we have the best evidence on that time frame. But we recognize, and increasingly so, that not everyone can get vaccinated in that time frame. And the CDC acknowledges that and recognizes that there are going to be people who have delayed vaccination. And there were also people deliberately calling for delayed vaccination in order to get more single doses in. So my advice is get that second dose whenever you can.
Thanks, Bill. And we're just about at time, so I'm going to wrap up and thank Beth Blauer, Jennifer Nuzzo, and Bill Moss for joining me today, and give a big thank you to everyone who joined us, and especially to those who submitted questions for our experts to answer. This briefing will be archived and available on coronavirus.jhu.edu. As a reminder, we'll be offering regular 30-minute briefings on Fridays at 12 p.m., but next week we will not, because it's the Memorial Day holiday, so we will not have a briefing next Friday, but we will be back the week after that. And as always, in all of our briefings, we'll focus on what you need to know right now about the COVID-19 pandemic, and we'll have live Q&A with our experts. Until our next briefing, which is in 2 weeks, thanks and stay safe.